Hi, I'm Dr. Scott Sinamore,
And I'm Dr. George Ragu from RBK Pediatrics and Urgent Care.
and we just put this together this video for you in anticipation of your visit to RBK with your 5-year-old kiddo. Just kind of let you know what to expect and go from there. So it's been an entire year since our last visit here. We got a lot to catch up on. We'll talk about everything that's gone on for the past year, any updates, any questions, any concerns, anything that you need to talk about, we're here for. The growth curves are still the most important thing that we look at these visits, making sure your child is growing and gaining weight appropriately. We review all of the developmental milestones. And of course, we do a nice full physical exam, and then we talk about vaccines.
Now, what kind of updates would you be expecting to talk about, Scott? Dr. Scott?
So at this age, the kiddos are out and about a lot more. They're interacting with their peers. They're interacting with their parents. They're interacting with everybody. So behavioral concerns, feeding concerns, sleeping concerns, all the usual stuff with living our lives with the kids at this age, they're starting to do more on their own and start to do more independently. So it becomes more about guiding them and what do I do in X, Y, or Z situation at this kind of age.
Okay, that's assuming that nothing has happened medically. But unfortunately, by 5, things do happen medically. Some children can have an appendicitis. They may end up going to a specialist like a pulmonologist for an asthma-like event or a seizure disorder. Some children may have had surgery. They may have had an allergic reaction. So we like to ask, do you have any new allergies to medicine? Have you visited any specialist? Have you visited the emergency room for whatever reason? And so forth. So those are important things to get into the medical record.
Very important, and make sure that we have them so we can see them
Yes.
in the future too. So guidance for a 5-year-old child. So we want to encourage them to be very physical. We want them running around. We want them exploring. We want them climbing and running and jumping. We want them doing it safely though. So always keep an eye on them. We also want them to develop the fine motor skills, and they're going to be learning how to read and to write and color and all of these other things. Now is the perfect chance to keep them practicing and get them better and better and better at it. And that's all it takes is just practice. Coloring books, crayons, pencils, it's all great for the kids. More is always better. We would much rather them doing that stuff than just sitting on the couch watching a tablet. What's your advice for sleep at this age, Dr. Rogo?
Well, at this age, they are 5 and they're growing rapidly. And in order to grow, you need to sleep. So they should be doing about 10 to 13 hours of sleep per night. And the best way to get the children to sleep is to have them have a consistent bedtime. So they should go to bed round about the same time, and they should wake up round about the same time. And an environment that they sleep in should, be sleep friendly, meaning there's not too many things to distract the children, noisy things, TVs, video games. All these things tend to distract the children and they cannot go to sleep.
Mm-hmm.
Yep.
The other thing that we like to talk about this age is the nutrition too. At 5 years old, they're able to fight back a lot against you, a lot better when it comes to the pickiness with the eating and stuff. It's always important to make sure that we, despite what the kids want or don't want, that we always continue to provide them the most nutritious meal that we can. This is a golden opportunity to get the good habits into the kiddos. And so the kiddos end up wanting the foods that they're eating. So if you keep giving them the healthy foods, that's what they'll end up craving, and they'll stop being a little picky. Still though, the advice remains, kids don't need anything to drink except for milk and water. Juice and soda and all of those sugary drinks, the kids don't do anything with that sugar except add it onto their bodies there. It's very unhealthy for them.
And the sugary stuff also goes to the teeth. If they drink too much sugar, soda, juices and things, it ends up creating a lot of dental decay and cavities and infections and so forth.
It's true. Unfortunately, very common at this age for that reason.
Yes.
We also still like to promote the family meal time for the kiddos. They're talking more at this age, and that's exactly what we want, is we want everybody sitting around the table talking, spending time together, bonding, all of that practice. It's great family time, and it's great for the kiddos. We still recommend the dental visits every 6 months at this age, and continue to have the kiddos brush their teeth twice a day. Keep that habit going. Safety, very important at this age. The kids are running around on their own. What kind of advice do you like to give the parents for that?
Well, they're 5 years old, so they're even bigger and they're even stronger and even a whole lot more faster.
Mhm.
So in the car, they should, be in a car seat belts. If you're walking on the street, look both ways before crossing the street. If they're starting to ride a bicycle or they have those electric scooters, they should always have helmets when they're riding them. So it does prevent a lot of injuries. Childproofing the house is important because children climb onto things, they fall off of things, and very important is the summertime safety, the water safety. 5 years old, they're very fast, they can swim, but they should never be left unattended because many times, especially in Long Island, there's a lot of pools. People have a lot of parties, and if there's nobody that's designated to watch the children, a drowning event can happen even in your own backyard.
It's true.
Yes.
Helping encourage the kiddo's social and emotional growth is very important at this age also. It's important to try and encourage healthy relationships with their families. Keep encouraging them to go over with their brothers and their sisters, to sit with them, to ask them stuff. Encourage the hugging and the kissing and the emotional sharing is very good for the kids at this age. And it teaches them as they get older, they don't have to keep everything bottled up. They can come to mommy and daddy and tell them about things. Teaching them about empathy, sharing, and especially problem-solving skills is very important at this age because that's what's going to set them up as they start going to school and stuff like that to avoid having issues and stuff like that. When kiddos come to you with an issue and ask you to do something for them, it's important that you show them how to do it themselves. Give them the practice doing that. Show them that they can do this stuff and they don't have to come running to mommy and daddy for everything they need help with. As far as encouraging the language, it's all about positivity. The more comfortable we make the kids speaking, the more they're going to speak. So keep asking them questions, being very positive, smile a lot, give them lots of compliments. The kids respond very nicely to that and they want to keep talking in that way. What other advice do you give for modifying the behavior at this age?
You should encourage them to be curious and to explore things within reason and within safety, and have them figure things out, like problem solving. They should put puzzles together. They should put, things together. The children, they have the Lego things, toys, the bigger Lego toys for the children to stack and develop and build things. They should use their creativity and figure things out.
Definitely.
Yeah. And of course, limit the screen time. There we go, screen time.
Always the big one. Remember, we recommend 2 hours a day or less of interactive screen time, educational. We do not want to just turn on YouTube and have the kiddos sit on the couch. We don't want to just turn on the TV and have them chill. We want them learning something. We want them reading. We want them interacting. Also, kick them outside. Make them run around. Make them play. Make them play with their friends. They're learning social at this age also. So very important. Vaccines. What can you tell us about vaccines?
Vaccines at this age, we're probably already caught up, but we may have not given the polio and the DTP. We may have to catch them up on that one. And if it's the fall months, we may have to give you the flu shot. We're not going to send the child to the laboratory for routine blood work because there is none. We may do a CBC. They may require a lead for school, and they may also require a PPD, tuberculosis test for school.
Yep.
Yes.
And also make sure you ask any questions you have about any of this stuff. We're here literally to teach, to help, anything you need. So it's going to be another whole year before we see you guys again. We are always around. Make sure you call us for anything you need, anytime you need it. We have doctors on call 24/7. We would much rather you call us and get the real answers for things than look online for stuff like that.
Right. And
hopefully you learned something from this video, and we look forward to seeing you when you come into the office.
And remember that RBK Pediatrics is primary care when you want it, urgent care when you need it.